Public Health is working diligently on conducting case and contact management, and both individuals are in isolation. I want to reassure Ontarians that we are prepared and ready to respond to this or any other new variant. The Ontario COVID-19 Genomic Network is continuing to actively monitor for all potential variants circulating in the province, including the Omicron variant. And it is conducting genomic sequencing on 100% of eligible COVID-19 positive samples in Ontario. We also have the infrastructure in place to manage outbreaks, including high volume capacity for testing, with 230 assessment centres and community labs and over 500 pharmacies offering testing to those who need it. In order to rapidly identify and trace and isolate COVID-19 and its variants, we have already expanded eligibility for provincially funded COVID-19 PCR testing at all testing centres to individuals who have returned from or travelled in the following locations between November 1st and December 6th, 2021. South Africa, Botswana, Lesotho, Eswatini, Mozambique, Namibia, and Zimbabwe. Asymptomatic family members and other household contacts of travelers are also eligible for testing. This list of travel locations may be updated as we learn more about the new variant and risk globally. Anyone experiencing symptoms of COVID-19, even if they are mild, is strongly recommended to get testing. And achieving the highest vaccination rates possible remains the key to reducing the risk of COVID-19 transmission and significant surges in cases. Please, if you are eligible for a booster dose, book your appointment today or provide yourself with an extra, which will provide yourself with an extra layer of protection. And if you have not yet received the vaccine, please do so as soon as possible. This includes vaccination for children aged 5 to 11. I also continue to urge all Ontarians to remain vigilant and continue following the public health measures and workplace safety measures that have been working for all of us and helped us get through the last 20 months. However, we will continue to monitor trends in key public health and health system indicators, monitor for and learn about this new variant, and we will act quickly in partnership with our federal colleagues if necessary. We continue to be in constant contact with the Public Health Agency of Canada and other jurisdictions to monitor the developing situation and ensure coordinated, effective, and shared efforts to protect the public. I know that this news of the variant feels concerning, but vaccination in combination with public health and individual protective measures has been working to reduce the spread of COVID-19 and its variants in our communities. So please keep up this great work that has got us to this point in the pandemic. We will continue to keep you updated in the coming days and weeks as we learn more about Omicron. Thank you, and I'm happy to take questions.
We'll go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Randy Rath with CHCH-TV. Please go ahead.
Well, hi, Doctor. Thanks for taking my question. I'm wondering, we have some significant steps taking place tomorrow on the COVID front, that the PCR tests will no longer be needed to cross the land border, and the John C. Munro Airport in Hamilton is starting to accept international flights again. Should those moves go ahead, in your opinion, or should they be held back?
Yeah, so we'll have to be reviewing this with our federal partners. We were certainly in contact with them all weekend to talk about a testing strategy for all travelers returning to Canada. We will further review the testing strategy for the short-term travel for 72 hours or less. We'll certainly have to monitor the situation in the United States. I believe the President of the United States will be making an announcement this morning. So you're absolutely right. It's a fluid situation. Most of this is a federal responsibility, but we're at the table voicing any concern by the Ontario government to ensure that we're listened to. But it clearly is a complete federal responsibility on international flights arriving into Canada. As you realize, this is a rapidly changing environment. Lots of questions yet about this new strain that we have to have answers for. We need to understand really if this is a virulent infection, if it makes people significantly sick or leads them to hospitalization. We really don't have that information yet. So I could understand in an abundance of caution putting some measures in play like we've done already, and whether as we get more and more information we put further public health measures in play. I can assure you we'll work with our federal partners to do that.